Hi everyone, today this video is going to be about genetic testing, and basically I've begun along the path of having some genetic testing done for myself, and I thought it would be a good idea to document it all the same way that I did with my pregnancy. Obviously it's not going to be quite such a long and drawn out thing like a pregnancy vlog is, but it will be kind of like a mini vlog, I guess. Because obviously I'm not the only person in the world who has to think about genetics and what they could pass on to their children and things. People all over the world are living with genetic conditions, things that they inherited or things that they got by chance. And sometimes it affects the choices that we later make in our life. Something that has really come to light for me as I got older and sort of became more towards my late teens is that obviously I'm not like everyone else, and I don't have a name for it. And I recently came to the conclusion that it might be quite nice to have a name for it, if it is indeed anything. So I decided that I would like to have my DNA tested for anything that might be hanging around, and explain a few things. But there's another edge to this, in that my dad has myotonic dystrophy, which is it's a neuromuscular condition, and it is possible to pass it down to your children. Now obviously he wasn't really aware of it until he was about 40, and he's mid-50s now. Mid to late 50s, so he's had it for quite a while, and it wasn't really until I was about 19 that I figured I could have it too. And when I was pregnant with Leo, it was a real worry for me that Leo would be born with some kind of problem, with some severe disability or just some kind of severe compromise. Fortunately he wasn't, and he's perfectly healthy and very bright and able and all those things that you hope your children are going to be. But some of us just aren't that lucky to have healthy children. And having had the experiences with my sister, I don't want to have to do that. I don't want to have a disabled child. It may sound selfish, but I've seen it firsthand. I can't do that again. Not that it was me doing it, it was my parents, but I just don't want to have to do what they did. Her condition was completely unrelated to what my dad has. So it was just bad luck, basically. So the myotonic dystrophy is, like I said, neuromuscular, and basically it affects all muscles of the body, or it can affect different groups of muscles. And it is it's kind of characterized by sort of lack of muscle tone, wasting of muscles, unable to sort of get a good tight grip on things. It can affect your eyes in that it can make it difficult for you to focus properly. It can affect your heart and cause arrhythmia. And my dad has the adult form of it, so it's a late onset thing for him. My parents have always said that I'm asymptomatic, but to be honest I am just not content with that until I absolutely know for sure. Because if a man has myotonic dystrophy and he passes it down to his children, the children will have adult form myotonic dystrophy, so they'll get it later in life and it won't be as severe. But if a woman has myotonic dystrophy and she has a baby and she passes it down to that baby will be born with the congenital version of myotonic dystrophy, which is much more serious, very severe, and quite often the children do not make it to adulthood, which obviously is not an outcome you would wish for yourself at all. All you hope to have is healthy babies. So that's really kind of why I'm doing it. I'm finding out for myself, but I'm also finding out for Leo and any other children that I may have in the future, because I don't think it's responsible, if you have a pre-existing condition, it's not responsible to then have more children and keep creating and what's the word, like just keep putting faulty genes out there. I just think it's irresponsible. So I'm doing this because I think it's the responsible thing to do, and I'm sure that there are lots of people out there with genetic conditions that would agree with me. The last thing you want is a less than happy life, or a less than a bad quality of life for your children. You want them to have the best. So you do the thing that you think is right. And this is what I think is right. So now that I've got the preamble out of the way, I can tell you all what happened yesterday, which was just a preliminary appointment with my GP to actually get the referral to the hospital and have some tests done. So we talked about it. I saw the family doctor and he knew the history. So he remembers me as a little girl, and he was perfectly happy to refer me and let me have some tests done. And hopefully I'll be hearing about that not too long from now. I'll probably get a letter in the post, and it'll tell me with a date and a time and where I need to be. He said that he was going to refer me to a neurologist rather than just a lab doctor, because a lab doctor will just take my blood and analyse it, and whereas a neurologist will actually look at me as a whole person. And I imagine, he said that there'd probably be other tests involved besides a blood test, so the only thing that I can imagine they would do is maybe an MRI, where they can look at the entirety of me and decide what is not I hate the word normal, because normal suggests like there is a standard, and I suppose there is, but I don't know. I'm just not average, and I guess that's what their job will be, to work out why and how I am not average, and what this will mean for me in the future. I'm trying not to sort of get too carried away and assume the worst. I have several sort of degrees of case scenarios in my head, so best case and worst case scenario, and all the sort of varying degrees in between. Obviously I'm hoping for something up the best end of the scenario, but like I said, not everyone is so lucky, and whatever comes my way, I am going to have to just deal with it and meet it head on, because it's not going to go away. This is real. So yeah, how do I feel about it? If I think about it in the wrong way, I can get very upset about it, because obviously it's not something people want to contemplate a lot of the time. Is there something wrong with me? Can I pass this down to my children? And will it mean, all these other things in the future? It's not a happy thought. But it's a necessary thought to have. It's better than not dealing with it. And I've just been putting it off for so long now. And now that it's not just me involved, it's Leo as well, I cannot put it off any longer, and it needs to be met and dealt with. So yeah, I will do my next update when I have confirmation of when the tests are, or several dates. I don't know if they can all do it in one day, or I don't know, but I will I'll be keeping you updated. So hopefully this is helpful to some of you out there who are maybe going through similar things as me. If you have any sort of stories or support you want to offer, I'd be more than grateful. You can send me an email at littlemamauk@gmail.com, or you can comment in the comment section below, or send me a message, however which way you want. So yeah, look forward to hearing from some of you. Thanks for watching. Bye.